Hello, I am glad to be with you here today. I am James Hill from Brigham Young University, and I just graduated with my Bachelor's of Science in Mechanical Engineering a week ago, so I feel a great amount of freedom at the moment. During my time at BYU, I have been passionately researching gut health, and gut health is a big issue. According to the American Gastroenterological Association, over 40% of Americans stopped routine activities last year due to uncomfortable bowel symptoms, and a third of them felt uncomfortable discussing with their doctor due to anxiety over treatment and diagnosis methods. This means many of them go without any diagnosis, leaving the cause of their pain undiscovered. One of the most likely culprits to their discomfort is a dysbiosis or an imbalance in the gut microbiome. This dysbiosis of the gut microbiome, in addition to these direct symptoms, has been linked through numerous studies to a significant number of other human health conditions, including inflammatory bowel disease, kidney disease, coronary artery disease, diabetes, obesity, and hypertension, which collectively impact over half of the United States population, cost over $1 trillion annually, constituting over 20% of all U.S. healthcare related expenditures. Now, while we know there exists a link between these conditions and the gut microbiome, the exact strength and dynamics of this relationship remains largely unknown, primarily due to inadequacies in current sampling techniques. Traditional sampling methods, such as those listed here, are either highly invasive or inaccurate, and none of these allow for a continuous long-term study, but rather these methods take only a single sample point. In recent years, ingestible solutions have been developed as a minimally invasive and lower cost alternative, but still typically require only a single sample of intestinal fluid. Some of these devices, however, track the pH of the gut. Due to the breakdown of carbohydrates into short chain fatty acids by gut bacteria, there exists a direct link between pH and microbiome health. Though these devices require a few more samples, they are still transient and limited to the timetable of the digestive tract. With this in mind, we felt it was critical that in addition to the basic functionality of these devices, a novel device should enable real-time continuous data acquisition over a span of 14 days. This device should also be ingestible to ensure it remains minimally invasive. These design specifications led us to begin with the Medtronic Bravo gastric reflux capsule. This device already possesses many of the key characteristics that we desire, including having a small package size and the ability to regularly measure and transmit data wirelessly. However, this device has a battery life of only a few days, thus necessitating a few modifications before use. These modifications included removing the existing batteries, replacing them with a larger battery, and encapsulating the device in a new layer of epoxy. Upon making these modifications, we performed some in vitro validation. We performed several biofouling tests to assess the device's accuracy and track the margin of error over time to ensure that the harsher conditions of the intestinal environment would not impact the accuracy over the study period. Performing a man-candle analysis on this data revealed no trend in the accuracy, thus validating the device for further study. We are currently undergoing in vivo validation in porcine subjects. In this study, each pig will receive 2 capsules surgically implanted in the cecum for a period of 14 days. Some subjects will receive a probiotic treatment, while others will receive no treatment, thus verifying the capsule's ability to detect variation in the gut microbiome. We expect to have our first batch of data back this upcoming Friday. Yet before we could take this prototype to a product, there remain a few key elements to address. As mentioned previously, this device is to be swallowed and thus requires an attachment mechanism to autonomously attach to the intestinal wall. This automatic attachment system is another area of research in our lab, and there are currently a couple of proposed designs for this solution, as shown here. Additionally, the device would need to be remanufactured from new components rather than being repurposed from an existing device. Additional market considerations to bring this device to the public include the regulatory pathway to FDA clearance, where the Bravo capsule could serve as a predicate type 2 device. Additionally, it's important to factor in reimbursement pathways. There exist several other procedures currently in use that are regularly reimbursed, establishing a precedent for devices such as this to also be covered by healthcare providers. Lastly, as we consider the cost of the device, we assume that it will be about the same as the Bravo capsule, which retails at $225, constituting a minor part of the overall cost of diagnosis and treatment. The result of all this analysis is that this device has significant potential to fulfill a market void and enable long-term and continuous and minimally invasive analysis of the gut microbiome. This provides individuals, especially those with anxiety over typical traditional diagnosis methods, with a better knowledge of their own gut health, facilitating more effective treatment strategies and therapies to help these people live their lives without interruption.